Hey everyone, welcome back to our channel. My name is Brianna Wilson. I'm a certified dementia practitioner and the founder of Bambu Care. In today's video, I wanted to address who you should be talking to if you start noticing dementia-like symptoms, including changes in mood and personality, and you are trying to get answers or even a diagnosis. So we are going to cover the primary care physician, geriatrician, gerontologist, neurologist, and neuropsychologist. Lots of healthcare professionals, but I'm going to try my best to break it down and make it super easy to understand, okay? So, first things first, you always want to start with the primary care physician or PCP, stating all your concerns and symptoms, all of them. And so if it helps, I highly recommend that you write them down so that you have a list ready to go for the physician, one that you can actually give to them. So if you want to keep one for yourself, make sure you make a copy, okay? Any good primary care physician will follow up with screening tests, assessments, they'll order scans and run labs because essentially what they want to do is a rule-out process to see if they can determine what may be going on. And then depending on their findings, they may refer you to a specialist who can look into certain areas a little bit more in depth, okay? Now, geriatricians can also serve as PCPs, and it could be a good idea to have a geriatrician involved in care if the person is over the age of 65 years old, but they don't have to be, and they have a complex medical history. So maybe they have hypertension and high cholesterol and diabetes, or they take several medications. So a geriatrician is a medical doctor who specializes in comprehensive care of older adults. And because they are a medical doctor, they can also prescribe medications, okay? Now, geriatricians and gerontologists are often confused, and sometimes the terms are even used interchangeably. But honestly, that is not correct because they are different and they have different roles. So a gerontologist is going to focus on the social, psychological, and cultural aspect of aging and provide insights into improving the quality of life and the well-being of older adults. And most gerontologists are not medical doctors. Some are, but most are not. And because of this, they do not typically diagnose or prescribe medications. And so a gerontologist could be a really good option for someone who is over the age of 65 years old. Again, they don't have to be exactly over 65 years old, but they are wanting a more holistic approach to their care, and they're not looking for just a solution in medicine, okay? So depending on the PCP's findings, they may refer you to a gerontologist, but they could also refer you to a neurologist or a neuropsychologist. So let's talk about the difference between a neurologist and a neuropsychologist, okay? So when we think of a neurologist, we want to think of a medical doctor who focuses on conditions and disorders related to the brain and the spinal cord. They can perform neurological evaluations, they can order imaging tests like MRIs and CT scans, they may do a quick cognitive screen, but it's usually nothing in depth, and they can make a definitive diagnosis in some cases. They also can differentiate between the different types of dementias in some cases, okay? But neurologists are a good option when whatever is going on in the brain doesn't just have cognitive manifestations, but also physical manifestations. So, for example, if the person develops headaches, weakness, tremors, an altered gait, balance and coordination issues, motor planning issues, or maybe they've had a stroke, a neurologist is usually the specialist that you want to follow up with. And because they are a medical doctor, they can also prescribe medications. Neuropsychologists, on the other hand, are not medical doctors. They typically hold a PhD or a PsyD, and their role is to focus on how the brain not only impacts cognition, but emotion and behavior as well. So they do perform in-depth cognitive testing to evaluate things like memory, attention, problem solving, language, processing speed, and visual spatial functions, and they also address emotional and behavioral challenges. Now, because they are not medical doctors, they do not prescribe medications, but they do work closely with medical doctors like the PCP or the neurologist who does prescribe medications and can manage medications, okay? Now, it is my opinion that if you or the person that you're concerned about is experiencing challenges with your cognition and are noticing changes in your physical abilities, mood, and or behavior, and you do not mind going to the doctor, that you follow up with at least the primary care physician, a neurologist, and a neuropsychologist. That way you can have the most well-rounded perspective of what may actually be going on, because not everything that looks like dementia is dementia, and it's important to figure out what is actually going on so that you can receive the proper treatment, okay? And when you see these doctors, please, please, please do not be afraid to ask questions, be persistent, and advocate for yourself or the person that you are concerned about, okay? So that is all I have for today's video. If you have any questions or would like to share your experience, please feel free to leave a comment below. And until next time, bye guys.